Thank you to the British Society of Lifestyle Medicine for inviting me to give this talk on sleep and insomnia and sharing some of the research we've been doing over the last few years on this subject. For those of you who don't know, I'm a consultant oncologist, so I treat people with cancer, but I also lead a research laboratory or clinical research unit investigating lifestyle and nutritional strategies, how they could be incorporated into mainstream medicine to reduce side effects of treatments, to prevent disease, and ultimately to improve outcomes. So we do surveys, we look at international evidence, ultimately design double-blind randomized controlled trials, which is the gold standard in getting research, and we advise charities, run a blog and a newsletter, and put the evidence into a book which comes out every 1 or 2 years. So anyway, we're going to talk mainly on sleep today. How much sleep do we need? Well, the sort of aim should be between 7 and 8 hours a night, but more if you have symptoms of sleep deprivation, such as sleepiness in the day, having to take a nap, poor concentration. Now, various studies show that about 30% of the population get less than 6 hours a night, so they're probably sleep deprived. And 20% report that this is a major problem and they seek medical advice. After cancer, of course, these statistics are worse. About 70% of patients report insomnia, worries about the disease, logistics, getting to appointments, anxiety, primary cause. But of course, we give hormone therapies. People have made prematurely postmenopausal, they're suffering from night sweats, poor mood, joint pains, can keep them awake. And the drugs we give, so steroids keep people awake. But we did a study a few years ago looking at changing from tamoxifen to aromatase inhibitor. And we had no real idea that this was associated with sleep loss until we did a study and recorded the symptoms accurately, which points out that we should be asking our patients about this symptom. We should be taking it more seriously, and also highlights the benefit of formal research to get this information. And it is important after cancer to sleep well. This was a study of nearly 4,000 people, which showed that if you're an insomniac, you have an increased all-cause mortality up to 50%. But on the other hand, the same study showed that if you sleep more than 9 hours a night, you also have an increased risk of all-cause mortality compared to people who sleep sort of a normal amount between 7 and 8 hours, which this sort of is a good example that more is not always better. Now, many of us have been touched by COVID, and particularly long COVID, and this study quite nicely emphasizes that only 9% of people in this situation said they slept well. So the majority of people post-COVID have problems sleeping. So why is sleep important? What happens when we sleep? Well, basically it reboots the circadian rhythm, and it reboots various other structures throughout the brain. It's an evolutionary advantage to sleep. In the day, the brain needs up to 20% of the energy we have in our body. So it's actually at night you use less energy. As a sort of species, we can preserve energy going forward. So more importantly, when you produce energy, you create these things called reactive oxygen species, or free radicals, which whiz around the cells and they can damage the DNA and cause mutations, which could ultimately lead to premature aging and cancer. So the more energy we need, the more free radicals are generated. So when the energy system slows down, we don't generate as many free radicals. Also, when the cell cycle slows, it gives time for the normal DNA repair mechanisms to kick in. So when the cell's dividing too rapidly, then we don't get time to repair the DNA. So it gives time for the brain to repair itself at night. Also, at night, the removal of toxic metabolisms through a system called the glymphatic system increases when the brain isn't preoccupied with activities in the day. So it's at night you clear some of the toxins from the cells. Also, because you're using less energy, it restores the energy stores, such as through glycogen, increasing glycogen and ATP. So you start the morning with a replenished, repaired brain, and the cortisol levels have increased, and you stepped the right foot forward. That's why if you don't sleep, it's not a surprise. It's associated with an increased risk of things which ultimately cause further degeneration. So, for example, blood pressure dips at night normally, but if you don't sleep or sleep less than 6 hours, you don't get this nocturnal dipping. So blood pressure overall goes up, which leads to an increased risk of heart attack, stroke, and dementia. When you don't sleep well, your appetite remains high, and there's various hormones which are generated through this mechanism. So you tend to eat more and put on weight. And also your blood sugars don't drop. So your sugar levels remain high 24 hours, and that leads to insulin resistance and diabetes. It also, your gut doesn't slow down. So acid production is higher, and this can damage some of the healthy bacteria and lead to poor gut health, which I'll come on to later. So it's not a surprise that chronic insomnia is linked to a lot of degenerative conditions. And of course, we know what it feels like not to sleep very well. It's quite normal to do that from time to time, but it leads to crankiness, fatigue, accidents, and demotivation to, do more healthy habits like eat well and exercise. So if you're a doctor or a lifestyle practitioner, or just looking at yourself, what can we do? What are the pathways we can do to look at insomnia? Now, first of all, it must be said that insomnia is not caused by a single thing. It's it's multifactorial, and then the solution to insomnia is clearly multifactorial as well. So there's no quick fix. So the first thing we should all look at is, are there any physical conditions which are keeping people awake at night? Well, the obvious one is anxiety and depression. Are there ways we can treat those specifically? Are you in any pain, particularly joint pains, particularly the knees, for example, putting the knees together? They could be practical things like putting a pillow between your legs. Nocturia, so getting up at night to pass water. There's advice you can do to reduce that. Hot flushes or night sweats, and maybe some medications such as steroids. I've already mentioned aromatase inhibitors, but even things like statins and glucosamine are linked to perhaps some restless nights. So you can look at the medication, see if we can tweak that a little bit. Now, I mentioned that sleep can damage gut health, but it's most often the other way around. If you have poor gut health, so an increased proliferation of pro-inflammatory bacteria and a leaky gut, there's 3 obvious pathways which occur which ultimately affect the brain, and it's called the gut-brain pathway. First of all, there's excess vagal stimulation, there's increased histamine and inflammatory release, and there's increased neurotransmitters such as cortisol and other sort of stimulatory neurotransmitters. Now, these all sort of tell the brain to sort of stay alert and to not sleep when you're supposed to. So it's a good idea if you're addressing insomnia. The first thing is to say, well, let's try to help the gut. Let's improve the profile of healthy to unhealthy bacteria, or improve the microbiome. Now, many of you know this already, but this is a combination of things: exercise, reducing processed sugar, stopping smoking, reduce the intake of processed meat. And then tried every day to have some bacteria-rich food in things like kimchi, sauerkraut, even some cheeses, kefir, that sort of thing. But also increase the intake of prebiotic. These are foods which feed the healthy bacteria, such as mushrooms, broccoli, turmeric, in prebiotic polyphenols and fermentable soluble fibers. So it's a combination of that process, but it has to be done every day. I've mentioned sugar. Yes, it damages gut health, but probably has other mechanisms to keep people awake. And certainly there is a lot of data to say that people who have high processed sugar intake have a lower instance of a good night's sleep. Exercise, there's a number of randomized, well-conducted studies which show that people who exercise regularly sleep better. So to put people into an exercise program would be a very good idea. good tip, try to exercise in the morning, preferably outside, because it helps with the circadian rhythm, because you're getting the blue light in the morning. And there are some studies showing that if you exercise late at night, you can keep yourself awake. Once you've excluded these obvious things, it's always good to look at sleep hygiene rules. And the obvious thing is to reduce caffeine intake in the afternoon, don't smoke in the evening or vape. Make sure the bedroom's comfortable, right temperature, dark, and not too noisy. I won't go through these specifically, but this website, keephealthy.com, has some good advice you can download. So what about coming on to actual tablets? Well, we know that night sedation, which you get prescribed from your doctor, does actually work. And the two most commonly prescribed are benzodiazepine or Z-like drugs. And these do help people go off to sleep. It's called sleep latency, the first part. And, I use them if someone's having chemotherapy and they're on high dose steroid. To take 2 or 3 days of a sleeping tablet is highly beneficial. However, in the long term, they actually reduce the more beneficial part of sleep, called the rapid eye movement sleep. And that's the thing which is most associated with long-term health. And over time, the duration of time you get benefit from them gets shorter and shorter and shorter. So you might get sort of 4 or 5 hours initially. After you've been on them for a month or two, you might only get an hour or so. So they're not really recommended for chronic insomnia. And more worryingly, there are some studies which show people who are on long-term night sedation actually have an increased overall mortality rate. So what about self-help over-the-counter remedies? Most people are very confused, but this is a lot available. But effectively, there's sort of antihistamine type drugs, and there's the others. So antihistamines do actually cause a bit of sleepiness, some more than others, and they can help you get off to sleep. But there are studies to show they don't tend to improve overall sleep quality. They can be associated with things like dry mouth and actually agitation. And more concerning, there are studies show that antihistamines in the longer term can adversely affect gut health, and they are associated with an increased risk of dementia. So again, short-term use, okay, long-term not. Melatonin. Well, we need melatonin in our body to help with the circadian rhythm. But you can actually take melatonin as a tablet. Not so much in Britain, but you can buy them over the counter in the USA. The problem is when you start taking a tablet, you're then telling your body it doesn't need to make melatonin, because it's a thing called negative feedback. So the more you take it, the more the body stops making its own melatonin. So you're actually making the situation worse. So there are some studies showing that a short course of melatonin might be beneficial. But this overview of 35 randomized controlled trials actually came to the conclusion that it would not recommend melatonin for long-term use. But on the other hand, taking foods which do naturally increase melatonin levels, like pomegranate, chamomile, and citrus fruits, they naturally tell your body to make more melatonin. So a general advice would be to increase the intake of those foods. There was a study looking at magnesium, although small numbers, and it did show some benefit. But this study did not measure underlying levels of magnesium, and I suspect strongly it's just a case of correcting a low magnesium level rather than actually taking higher than you need. So it would be a good idea to make sure you have plenty of minerals in your diet, particularly magnesium through sugar-free chocolate, pumpkin seeds, shellfish, and things like that. Now, a herb you often see on the shelf is called valerian. It's either on its own or mixed with other ingredients. And it does tend to induce a little bit of fatigue, so it might help getting off to sleep. But this overview of 17 randomized trials said actually the measurable benefits of overall sleep quality are not good, and the studies are conflicting and inconclusive. So in general, more researchers need to say, well, is this a practical resource? Chamomile, on the other hand, has got some interesting data. It does tend to cause relaxation, but without sedation. And it can improve GI symptoms and elevate mood. So most of the studies using chamomile, such as these two here, actually gave chamomile throughout the day as well as the evening. So it's more about preparing the body throughout the day so it gets a better night's sleep in the evening, which makes much more sense. So that's that's interesting. The problem is, a cup of chamomile tea probably has very little active phytochemical in it. I'll come on to studies using chamomile a bit later. There's some studies using B6. Again, they didn't really improve sleep quality. They possibly improved dreams, which you may think is an improvement or not. Depends what you're dreaming about, I suppose. Overall, the main data is that if you have diets low in vitamin B6, you tend to have worse sleep quality. So as a general rule, look for foods which have B6 in them, such as chickpeas, eggs, nuts and seeds, and increase those generally in your diet. Vitamin D, this was a meta-analysis of 13 randomized trials, and not surprisingly, because vitamin D seems to be the answer for everything these days, it did show that if you give vitamin D supplements, the sleep quality did improve overall. Again, these studies did not measure baseline vitamin D, so I suspect strongly it is, you're correcting a low level will get the benefit, but taking more than a normal level is probably not going to benefit you. Nevertheless, we know most of us are vitamin D deficient in the winter. We're doing a COVID vaccine study at the moment, and I was shocked to see, even in the patients who volunteered for the study were fairly aware of their nutrition, but 80% of them have suboptimal vitamin D levels. And many of those were actually already taking vitamin D supplements. And the problem is, if your gut health is not optimal, you don't tend to absorb vitamin D in your diet. So it doesn't matter what dose you take, you're not going to absorb it. The best data comes from a combination of vitamin D and probiotics. And that combination works very well because the probiotic helps the absorption of vitamin D, and vice versa, the vitamin D helps with gut health. There's not many supplements available. This one, Your Gut Plus, does have a combination of vitamin D and lactobacillus probiotics. And this was the one chosen for the COVID study I'm going to mention in a minute. Probiotics on their own, there is some data that it could improve the quality of sleep. Small numbers in the trials, but they were randomized and well conducted. I suspect, again, it's probably just helping the people who have poor gut health to start with. And perhaps more research needs to be done on this. But taking a probiotic as part of a strategy to improve your gut health does seem sensible. Which leads us on to one of the studies we've been doing recently. And this was looking at men and women who had symptoms after their COVID infection. So it might be either quite close to the infection, or most of the people in the study actually had long COVID, having symptoms for over 100 days. And it became very clear that gut health and sleep problems were very common. I have to acknowledge we did get some charitable funding for this through the Captain Tom appeal. So what did we know? What was the background to the study? We knew in the first part of lockdown that people with COVID had developed a poor gut health, either because they had poor gut health in the first place, or the virus itself damaged the gut. We knew that if you have GI symptoms or non-respiratory symptoms, you're more likely to have more severe disease and get long COVID. And insomnia and daytime fatigue was a very prominent feature of long-term problems. So we, as a research group, which are interested in nutritional therapies, thought, well, what could we be looking at to see if we can improve this situation? So we worked with a number of organizations throughout the UK who are used to developing nutritional products. And we looked at the data, not only coming through from COVID, but also the previous viral epidemics, like the last SARS epidemic. We looked to see which food could possibly have an impact. And we're, cut to the chase, because this is a short presentation. But basically, we found that there was a lot of evidence for lactobacillus probiotics, particularly. So this was specifically formulated for the study, which has a good quantity of lactobacillus of 5 different blends. It was supported by a good quantity of a prebiotic and a slow-release capsule. And these foods, these 5 foods, were found to be had the most benefit or potential benefit at this stage. So why is this? What do these foods contain? Well, they contain phytochemicals. So these are the chemicals which give food its color, its taste, and its smell. And these ones are particularly powerful. So they're called ellagic acid, curcuminoids, epigenin, quercetin, hespertin, and other citrus bioflavonoids, and resveratrol. Now, they work in a number of different ways. First of all, they are known to have antiviral properties, so they help the replication of the virus. They act as prebiotics to help with gut health. They are anti-inflammatory, so they dampen down excess inflammation. Now, during COVID, excess inflammation was quite a problem, and this was part of the thing which caused the excess inflammatory exudates in the lungs. And a lot of the medical strategies were to reduce this excess inflammation, but the trouble is that the drugs tend to lower the immunity, whereas these foods, they actually, if anything, they help the immunity as well as dampening the inflammation. We know of, as I've already said, they can improve circadian rhythm and they can help anxiety and reduce mood. So for the study, these sort of a specific formulation was made with fairly high doses of these 5 foods. And this is what the study looked like. It was a double-blind randomized controlled trial. So half the people didn't know what they were taking. The other half had the phytochemical-rich supplement, and they all actually got given a probiotic. Now, these were the results. First of all, this trial confirmed that sleep problems were very common, and also it confirmed that people who complained of bowel symptoms were more likely to get long COVID. So that was already known, but it was confirmed in the study. Now, we were very pleased to see that the intervention of the lactobacillus, even though many of the patients had symptoms for over 100 days, even within 10 days or so, they started seeing quite a significant reduction in fatigue and GI symptoms and overall quality of life and well-being. And this was very welcomed by patients who'd been suffering for months. Now, more relevant to this talk, when we randomized the phytochemical supplement or placebo, there was a further 3-fold improvement of all those symptoms in the intervention group. But more importantly, it wasn't just a reduction in sleep. There was a significant reduction in nighttime in nighttime sleep quality. People slept a lot better. Now, this was sort of a surprise at this stage, although we knew sleep was a problem. We knew if we're going to make people better, they're likely to sleep better. But we didn't realize it was going to be that big of an impact. So we looked more at these foods again, and basically this is where we think how they think they have such a good impact on sleep. Well, we've already said they help circadian rhythm. So they restore melatonin levels and indicate the body when to sleep. They reduce daytime fatigue, so patients weren't napping in the day. So again, that helps circadian rhythm. They help to reduce anxiety, particularly the chamomile and the resveratrol, so people are more relaxed when they go to bed. They help gut health by reducing bloating, reducing indigestion, which can keep you awake at night. But more importantly, they help the gut-brain pathway. They have anti-inflammatory properties, so they're less likely to be, to have joint pains and problems keeping you awake. And they improve mood, so you don't sort of ponder with negative thoughts all night. So it's probably not a single thing why they help sleep, but it's a multifactorial benefit. So from that study, I've already mentioned the probiotic is now commercially available, and they actually went on to develop 2 phytochemical-rich supplements. One which was mainly marketed for COVID, it's called Phyto-V, and the other one was actually marketed for sleep. Interestingly, although they say taking it at night, this is the type of thing which can be taken in the day because it's actually non-sedatory. But you wouldn't. This is very similar, and this is very different. So you'd either take this with one of these, but you wouldn't take these 2 together. We're now going on to look at whether the Phytonite Plus and the Your-Gut Plus could help people without COVID, because this data came from COVID patients. We suspect strongly it will because of how it works, but of course it remains to be seen, and this is going through ethics as it stands. But in the meantime, they are available through the manufacturers. So in summary, sleep disorders are common and the cause is multifactorial. Chronic insomnia is serious and under-prioritized by doctors in the hospital, certainly amongst oncologists. Conventional sedatives are good for short-term benefit only and have long-term risks. When you're looking at lifestyle strategies, you should look at the whole thing, exercise more, take more vitamin D, improve your gut health, eat foods more rich in magnesium and vitamin B. And in terms of over-the-counter strategies, antihistamines could work in the short term, but for most of the products you see, the data is lacking. But where the future lies seems to be with these non-sedatory phytochemical-rich blends, plus or minus probiotics. And there's some interesting research coming through. So thank you very much for listening. And I'm very grateful again to the British Society of Lifestyle Medicine for giving me the opportunity to speak with you. Good evening.